today is going to have some remarks, and then we'll have remarks by Mayor Kirk Caldwell, and a number of people are here to help answer questions about the subjects at hand today. This is regarding the state of Hawaii's response to COVID-19. Mahalo.
Thank you for joining us this Sunday afternoon. I think as we've seen all across the country and around the world, situation with COVID-19 is changing quickly and rapidly. And certainly we've been prepared, keeping on top of it and taking actions that we believe is necessary to keep our community safe. You know, as we've said many times, we are committed to being open and transparent and providing you as much information as we have. We don't have complete information, so we'll be sharing what we know at this time. First of all, today I will be talking about the 3 additional positive COVID-19 tests. As you know, we've been talking about private labs developing the capability to test. So these are different because they've come from the private labs. Late yesterday afternoon, Clinical Labs of Hawaii reported 3 positive test results. All 3 are travel-related. With exposure outside of the state of Hawaii. You know, once again, we do believe that community spread of the virus has not occurred yet, at least not that we have evidence for. 1 case is on Maui and 2 are on Oahu. The Department of Health, as we've discussed many times, once we get a confirmed positive, we go through the process of contacting the individual, identify what their activities were in the past few days and weeks, and then really work hard to make contact with those who may have come into prolonged contact with the individuals so that we can keep them safe and help them stop infecting others that they might come into contact with. The first case is a Hawaii resident on Oahu. The individual traveled to Colorado from February 29th to March 7th. Symptoms began on March 9th. A specimen was collected on March 11th. The person and family members have been advised to stay at home and be in self-quarantine. A child in the home had respiratory symptoms. A specimen was taken from the child and tested by the Department of Health here. And we confirmed that the sample was negative for COVID-19. So the child's symptoms is not due to COVID-19. The preschool that the child attends was notified that a relative in the home had tested positive for COVID-19, but there is no risk to the children at the preschool or staff. The child will not be returning to the preschool until after the quarantine period is completed. Case 2 is a flight attendant currently on Maui. We believe they're a Canadian citizen. Symptom onset began on March 9th. Last flight that the flight attendant took was March 8th. So we believe that the risk to any passengers on the previous flight is low. A specimen was collected on March 11th. The individual was exposed to a confirmed case in Germany on March 4th. Because of the notification of exposure and symptoms, the person self-isolated at the Royal Lahaina Resort Hotel on Maui. Following the positive test result, the individual was moved by AMR to an isolation at a Lahaina clinic. So that individual is no longer at the Royal Lahaina Resort. And then the final case, the third case, is a resident on Oahu. The individual returned from a trip to Florida with the entire family on March 8th. Person developed cough but no fever on March 9th. A specimen was collected on March 10th. The person is self-isolating from the rest of the family, staying in a bedroom with a dedicated bathroom. Other family members have been advised to remain in home quarantine, isolated away from the sick individual. As we started this press conference, it is changing very rapidly. We again encourage people to cancel non-essential travel. We do believe that the virus is now spread across the United States. Private labs are beginning to test, and we've seen some of the results. We want to remind people that if you have symptoms and are feeling ill, you should contact your healthcare provider. They can provide you guidance on what actions to take and whether you should be tested. I would like to note, as the private labs begin testing, that we anticipate seeing many additional cases and that we will need to find some other way to report the results moving forward. Once again, keeping our community healthy is a team sport. We need to all be committed. It is about practicing good hygiene in every instance, whether it be at work or at home. If you're sick, you should be at home instead of going to work. If your children are ill, they should be at home. We need to incorporate social distancing, and now is the time to implement many of those procedures. I also did want to announce that Hawaii, as you know, the public schools are currently on spring break. We have decided to extend spring break by 1 week. That would include the Kuhio Day holiday, so it's really 4 work days. The current plan is for students to return to school on March 30th. Obviously, that is subject to change depending on what the conditions are. During this time, school leadership and the public school systems leadership will be preparing plans to implement social distancing as recommended by the CDC when students return. It really is about changing how schools conduct classes. Virtually everything that they do will be evaluated so that we can implement appropriate social distancing activities that will allow us to keep our schools safe. We do believe that this will provide a better environment. We know how important our public schools is to our community. We know that we are committed to having a safe, stable place for our children during this time. We know that there is tremendous impact when a school or schools close. And so with that, I know the mayor had wanted to make some comment.
Thank you, Governor. Good afternoon and aloha. Wanted to thank the governor for inviting me to attend this press conference. And as you know, 2 of the 3 new cases are here on Oahu. And Oahu has almost 1 million people. The state has 1.4 million. So I look at the state and the city and county of Honolulu as really tied together at the hip. And we worked really close together to coordinate our responses, whether it be our preparedness proclamations and other things that we've been working on. It's critical that the message be coordinated and similar so that we assure the public on the proper response as we go forward with this pandemic, which I believe will last for quite a lot longer. And I think we will see cases spreading through our community just like the flu does, unfortunately. But it's incumbent on all of us to do our part to make sure that we mitigate that spread and we end this sooner than otherwise could be the case. I did want to emphasize a few things. Tomorrow the city will be holding a press conference announcing certain additional actions we'll be taking. But we want to emphasize that what the governor announced today and what other mayors have announced is we believe it's much better to be over-prepared than under-prepared. And sometimes people may even think we're being alarmist in our actions that we take. But I think it's better to go forward and then step back if necessary than to say, gee, I wish you would have done this earlier, and it's hard to catch up, particularly if the virus spreads. So again, I'm asking everyone to be prepared and not to react in a negative way when we do things that sometimes you think maybe look to be too extreme. Some of the things that we're looking here at the City and County of Honolulu is suspending our senior programs at our parks. They may be small events, but they're in a population that is most at risk to this virus. We've, as you know, suspended our neighborhood board meetings. We don't want to invite people to city events if it's not necessary. We're going to be announcing that we're going to cancel all of our Royal Hawaiian Band concerts. It's not something we absolutely need to do. And we are following the guidance of the Department of Health that they issued on Friday on large gatherings of 100 or more. We understand the CDC has now issued new guidance at 50 or more. So as the governor mentioned, it changes, and the calibration is important, but it has to be based on facts. And so we will take action to not invite people to events. And so, for example, the symphony that's going to be performed on Friday, we're going to ask them not to go for it. Again, we believe it's a population. A lot of seniors go to the symphony, and they could be exposed. But we could look at smaller events now, also working with Dr. Anderson, Dr. Park, and the governor. You know, with the suspension of schools for an additional week, we'll be working with our workforce because we're going to get questions about we have to watch our children. An additional week, they made accommodations for this coming week. Hopefully they can do it another week, but we'll work with our workforce to see if perhaps we can offer telecommuting, work at home, and those kind of things. And I'm sure that's going to be an issue for our entire public workforce and also the private workforce, too. It's critical, as you know, City provides critical core systems, things like water, sewer, garbage pickup, but even more critical than that, our police, fire, and EMS. Our first responders, they need to be protected. They do have their protective gear, but they have to make sure they follow proper procedure and that they themselves do not get sick and contaminate other members of these first responder group. We need them. We're also tomorrow going to be announcing a site where we think we can triage our homeless population should they test positive with the COVID-19 virus, and we'll be working with H4 and others in providing those services. If possible, we'd like to see people work from home, both in public and private sector, with agreement of their employers. We also asked that we saw this morning the Star Advertiser, Honolulu Star Advertiser, put out an edition where they have a whole section on cancellations. I think it's really important that everyone, and not everyone reads the newspaper, many people watch the news on TV, but to know what is being canceled, because we don't want people to come out of their homes and go to events and interact with each other when they're not occurring. So it's really critical to be up to date with the most up-to-date information. Something I wanted to emphasize that the governor talked about is compassion. You know, we are a place of great compassion. This aloha spirit does exist. And yet we see panic in some ways, and the lines at Costco and other places, and buying more than what you need. And just yesterday, we were with a presentation on sustainable food production. Native Hawaiian woman talked about so many of her clientele just go to the supermarket to buy the food for the next day. They can't afford to buy a month's worth of food or a month's worth of toilet paper. And so when someone goes and buys a whole case of Spam, and this person goes to buy 1 can of Spam for the next day, and they can't buy it, great disrespect for that person. And so I remind all of ourselves to be compassionate. You should be prepared and buy enough, but not overbuy. You leave everyone else, particularly those who are the least fortunate, more exposed. And we're asking to show aloha and think about it before you take action. You know, things like the harbors, the rumors there, you know, the auntie's uncle second removed 3 divorces before, you know, that the harbor is closed, and not true. And these kind of things need to be verified and not overreact. You know, Matson continues to come, Pesha continues to come. Don't expose yourself. And that's partly why the city's canceling events on their properties. We don't want to call people out and get interaction with each other unless it's absolutely necessary. So really good hygiene, washing your hands, can't say it enough. I think I've gotten to the point where I'm not even doing the bump anymore, the tap, or I'm just going shaka. I think in Japan you go, hai, wakarimasu. Here we go, shaka. It's a good way to go. And just recognize and show respect, but you don't have to touch each other right now. If you're feeling sick, stay at home. If you're feeling sick, stay at home. Don't go to work. Don't go do other things. Stay at home. I know that we'll get through this if we work together. And I hate it when I see people second-guessing and criticizing. You see some of the tweets, sometimes from elected officials, even criticizing whether someone can get a test or not. That's not helpful. It's not helpful. Working together, the governor's reaching out, has all of us on these video telephone conferences on a regular basis, sometimes longer than I would like to be there, but it's important for everyone to get their voice heard and to make decisions together. And I think it's going to be a long slog. It's not like a hurricane coming where we meet for a couple days and then it's pow and we all go back. This is going to go on. And so helping each other, not criticizing each other, working together, we can disagree respectfully and get to a decision, and then we implement. And I'm sure there'll be a lot more coming in the days to come. So thank you so much. Mahalo.
Questions?
Several states have already activated the National Guard and moved their COVID response into an EOC type of structure. Will Hawaii be moving into such phase, and if so, when?
We are planning, and there'll be, and we're planning an announcement on Monday about our specific plans.
Can you share any of those plans right now?
No, I think there are a lot of things that we are putting in place, and I'd rather do a complete description of how we'll be moving forward rather than give you information piecemeal.
So how many confirmed cases are we at right now? Is it 9 now?
Seven.
And considering that most of them, if not all of them, have come out of state, any concerns with more screening at the airports or anything we can do to keep them from coming into the state?
Well, I think that we certainly are in conversation with many individuals about how we can do a better job of managing incoming. Airlines are looking at not allowing passengers to board who are sick, obviously, and then we are looking at what kinds of things can we put in place. It's difficult to screen at the airport. There are thousands of people that go through the airports each and every day. So again, it really is about everyone in our community being responsible, travelers included. If you're ill, you should stay put at home. If don't go to work, if your children is sick, they need to be at home. Everybody needs to be responsible and take responsible action to keep our community safe.
Governor, are you making any other recommendations about child care, sometimes through YMCA, Kama'aina Kids, and other things that would normally be in place for spring break?
Certainly we'll be looking at supporting the schools and the actions that's required to support parents during this extension. We don't have an explicit plan, but we are in contact with all of the providers who provide activities during spring break.
But for parents who might be sending their kids to programs that start tomorrow, are they expecting it to be business as usual unless they hear differently from the provider?
Well, certainly whatever arrangement they have is what they should count on. Any extension of that activity needs to be discussed with the provider.
Sorry, just quickly, what would be the state's threshold to activate National Guard?
We are looking at what resources are necessary. So certainly I can tell you we will activate components of the National Guard that we feel are necessary. For the most part, those first to be activated would be those that help with the planning and putting infrastructure in place that allows us to execute. And then obviously the National Guard encompasses the full range of professions, you know, the doctors, nurses, medical teams. And so certainly we would be looking at what are the community needs and then standing up units as appropriate.
With the transition to working online for a lot of employees, in particular the University Hawaii system, does the state have adequate broadband capacity to absorb all of this activity?
Certainly, I do believe that the state as a whole has adequate infrastructure to support all the broadband activity. The state of Hawaii has I've directed all of the department directors and agencies to look at opportunities and those employees who can work from home, and certainly encourage them to facilitate that. Certainly, I would make that play out to all businesses, that they really should be looking at their operations and determining if their employees can work from home. That would be preferable. You know, again, the whole focus on social distancing is how can we mitigate the epidemic? You know, once it gets here, and I just want to remind everyone that we don't, at least at this point in time, have evidence of community spread, but we know that it will occur. And so what can we do to mitigate that? Yeah, you have seen all of the diagrams about the peak or the more spread out kind of impact. Social distancing is our effort to flatten the curve. And all of these actions, working from home, limiting events larger than a certain size, are all focused on allowing our community to provide adequate social distance so that when the virus does show up in our community, it does not infect a whole lot of people in one event.
Governor, because we haven't seen community spread, have you considered banning travel to Hawaii? Would you like to see that happen in the future?
I don't have the authority to ban travel to the islands. You know, certainly, as you know, we do get thousands of visitors to Hawaii each and every day. We do believe that Hawaii is a healthy and safe destination, but the virus has spread throughout the country. And so certainly we are concerned. We do know that all of these cases have been introduced through travel. And, you know, once again, for those who travel, we just ask that at the point that they display symptoms, then they should get tested and self-isolate.
Governor, do you have an update on the health status of the previous confirmed coronavirus cases?
I don't, but Sarah?
Our understanding is that the first case, actually, I shouldn't go by first cases, but the first two cases, one of which was hospitalized, that individual remains in serious condition. The second individual is recovering, and we're hoping to be able to release that individual from isolation soon.
The woman who was diagnosed in Colorado last week after having traveled to Hawaii says she had not been contacted by State Department of Health here?
Correct.
That's correct?
That is correct. So as soon as we were alerted by media about this individual, I immediately reached out to my colleagues, the state epidemiologist in Colorado, and we then discussed this case. They were well aware of this case, and they presented all the information they had, and they had basically made the determination that this individual had contracted their disease in Colorado, and based on the information that was presented to me, I concurred. So there are, I think it's safe to say at this point, because my Colorado colleagues said they were going to be announcing it, they have recognized community-wide transmission in the area that this individual currently resides.
Dr. Park, anything on the Canadian doctor in that case?
No, not at this time. We're still waiting for word from our Canadian colleagues.
Dr. Park, the Japanese residents who were diagnosed with COVID-19 when they returned to Japan, any update on that?
No, we have not heard any further updates regarding those two individuals.
With the extension of spring break and, I don't know, maybe more classes going online, how will the faculty, staff, and teachers pay be impacted?
The staff and faculty will not be impacted at this point in time. You know, the extension of spring break, it really gives us the opportunity to plan better for social distancing. Part of the planning is to ensure that, depending on obviously how COVID-19 runs, we don't want to impact the students or the faculty or staff. So taking this break to allow us to plan better is our effort to ensure that we can have appropriate education occurring through the rest of the school year so that our students can graduate, that we can implement plans to integrate social distancing into the daily activities at a school. You know, we're committed to ensuring that our schools can be a stable, safe environment for our children, that it won't become a location that would encourage the spread of any infectious disease. So, I mean, that's the objective. The staff will be working through that during the extension period, and we are committed. You know, we would be looking at school closures on a case-by-case basis, depending on what happens in terms of community spread of COVID-19. Again, all of the cases to this point are travel-related, and the Sentinel screening program continues. So we'll continue to get data about the presence of COVID-19 in our communities.
Are there some schools that are on year-round or multi-track schedules, couple A middle, medium
Yes.
middle? How will they would have been in session this week?
Right, and so they would be impacted, and Phyllis can respond.
Aloha, Phyllis Pasami, Deputy Superintendent. We are right now in conversations with the multi-track schools, and we are looking at also having them do an off-track of 2 weeks at the same time as everyone else, because we believe that is essential for these schools also to go through the planning phases of thinking about how they are changing their routines, their learning experiences and their ceremonies, making sure that they have the ample time to plan also.
So that would mean they would close too?
Yes, they will go off track. The term is called off track. Yes.
So they would close tomorrow as well?
Yes.
Governor, with the encouragement of people to stay home and work from home, is that including state employees and Mayor Caldwell City employees as well?
Yes, absolutely. We have had conversations with the employee unions about our effort to provide appropriate social distancing. I've directed all of my department directors and heads of agencies to look at working from home for employees as appropriate.
The same for us. We're following the lead of the state, and also the other counties are also following the lead in some degree. I think it's critical that we try to encourage people not to come into contact with each other, to stay apart as much as possible. You know, our announcement at the satellite city halls for driver's license renewals is part of that. We're working with our unions to see if perhaps we can go on a longer period of time, maybe 10 hours a day, for 4 days, and then they stay at home, you know, for those who have to come in. So there's a lot of different ways to approach this. We're looking at all of them, and we'll be rolling them out in the coming weeks.
Governor, as these results continue to roll out, top of mind for a lot of residents in these communities is, did I come into contact with that positive, COVID-19 positive person? We have heard at least one report from someone who was at the Hawaii Marriott saying they couldn't get any information from those at the hotel. What assurances do officials have that the information that you're providing to these businesses, airlines, restaurants, whatnot, is actually going to the people who get involved?
You know, certainly the protocol is to interview the patient and identify as many prolonged contacts as we believe would allow for the transmission of the virus. So certainly it's not an issue of if someone walked through a restaurant or walked through a location. It really is face-to-face prolonged contact with the individual. You know, we are contacting everyone that we believe we can identify who had prolonged contact with the individuals. So far, most of them were aware that they were getting sick and maybe had some indication that they may have came from a place. And so many of them were already kind of distancing themselves from each other. But maybe.
So the health department has been, of course, chasing contacts and identifying people who are at risk there. One of the key factors, of course, is whether the person is symptomatic. When you're coughing and sneezing, that's what we worry about, not necessarily that they may have seen the person or been in the same room with the person. So close contacts are our major concern. I want to say one thing in regard to screening at the airports and so forth. We, in other areas in the country where they've had some experience with this, and throughout the world, they found that trying to isolate themselves and close their borders is really largely ineffective in the long run. What it does is it prevents the disease or postpones the introduction of the disease. But what we're hearing from all sides is that the real answer to addressing the spread of the disease is social distancing. It's going to get here sooner or later. We can screen people and postpone it coming here, but it's going to end up here in Hawaii undoubtedly, and we're going to need to deal with that. And getting back to the social distancing, avoiding close contact with individuals, particularly those who are sick, maintaining your distance is really what's made the big difference. Now that we have no cases here that we know of that are locally transmitted, this is the time we need to take action. And although you're going to hear lots of things being proposed and implemented, and some people may be thinking, oh, it's too soon to do that, it's not too soon. You want to put the preventive measures in place before the disease is introduced, which means today and tomorrow and in the very near future. So I just urge that people focus on that. We can't continue just to chase cases that are here. That's not going to solve the disease problems that we're looking at. It's going to be all working together to minimize the spread of the disease, and that's going to be through social distancing. And I would just urge that that we focus on those issues. Anyway, I wanted to add that to the discussion.
Dr. Anderson, which airline did the flight attendant work for?
It's Air Canada.
Yeah. This particular flight attendant was working in Air Canada. Again, in this case, it's very important to know when that person was ill and when they might have been in a situation where they could have transmitted the disease to others. I'll also point out that just in the last 3 cases we've reported today, 2 were Hawaii residents. They would come back here anyway, again emphasizing the importance of dealing with this here in Hawaii and not trying to close our borders. Again, it's not going to keep us from having to deal with it eventually here.
A lot of spring break students are coming back, and some of them are coming back from areas where there is community spread.
Yeah.
What advice are you folks giving as far as whether they should be business as usual or staying at home?
Yeah, certainly we are advising and recommending people, if you are coming from an area that had community spread of the virus to many individuals, we would ask that you self-isolate, that you monitor your health, take your temperature every day to see if you do develop symptoms, then certainly have a conversation with your healthcare provider to determine whether you should get tested. Same thing with parents. I would suggest that the parents for students returning home for spring break, that they should self-isolate, ask their children to, or I guess adults, their college students, to self-isolate and refrain from social gatherings and connecting. Certainly monitor your health. If you begin to get symptoms, then talk to your healthcare provider. And if you become ill, to seek testing.
So maybe going off of what Dr. Anderson said, any consideration then of implementing the CDC guidance of 50 people or less at places? I know some states are closing bars and restaurants. Anything we should do on that front?
Certainly, we are reviewing the CDC guidelines as you had recognized. It just came out. So the mayor and I have we're just talking about that and what steps are next. So again, it's a very fluid situation, changing all the time. You know, we are reviewing all of our policies to determine appropriate actions to be taken to implement social distancing so that we can smooth that peak, so that we can respond to the virus and keep its impact as limited as possible. There would be an effort during the extension of spring break to clean the schools. You know, we are implementing, and part of the effort is to identify touch points and, you know, those areas that have lots of contact with students. So obviously student desks and all of that, but even beyond that, the high touch point areas on every campus will be looked at, and part of the opportunity is to look at changing cleaning period routines to ensure that we can keep those areas that get most use and touch from the students are cleaned more regularly.
Mayor, I don't know if it's too early to ask, but you know, with our first responders, obviously they have to be out there and be on the front lines. What precautions or what have they been told to keep safe, and if they do get sick, do we have enough in reserve to fill the shortage?
The short answer to your question is yes. You know, they've gone through the training to wear all the proper equipment called PPEs. They have sufficient supplies for the short term. Long term become an issue. We have to make sure we have backup supplies, and we are ordering more. So they're following the proper protocols. And, you know, sometimes they get a call to go to a house, and they're not told the entire situation. As they're driving there, they're asking, you know, did you travel from one of these places? Do you have symptoms that could line up with COVID-19? And then in a bunch of caution, they're preparing, even though maybe all the boxes have not been checked, they don't want to expose themselves, because that means then they have to go into quarantine. And that's one more person out of the system. We also, you know, in the case of firefighters, they come home, they have a home, and then they have a home at a fire station where they're in very close proximity. And so if a firefighter was to be exposed, they would be sent home. We wouldn't want them to get everyone else exposed too. We have those procedures in place. We feel confident right now, but it's incumbent on each and every one of those officers, whether it be HPD, HFD, or EMS, they're following the proper protocols every single time, including putting on the glasses and just doing everything they need to do, asking the right questions. And I think we'll be okay as long as those procedures are followed. Thanks.
Anyone else?
You know, and I just would want to add to that, right? We're asking the community to be part of the team, because if you are making a call to 911 and you do believe that you had exposure, you should be informing the 911 operators that, you know, I'm ill, I need help, I may have been exposed, so that our first responders are not put into jeopardy unknowingly. You know, we all know that they will be focused on doing their job and helping those in greatest need. We ask for the community's help. If you believe that you've been exposed, that you should be sharing that information on the call. The more information we have, the safer we can keep our healthcare professionals, our first responders, and everyone in our community that we need to respond to the COVID-19 epidemic.
That's a situation like the visiting couple that's on Kauai. They didn't inform anybody, so it wouldn't be
Right. So, I mean, so we definitely would encourage even our visitors, if they do believe that they may have been exposed, we ask that they inform everyone through every contact that they make for services. If they can inform us that they believe that they may have come into contact or have come from an area with high community spread, that would be helpful information for us to keep our employees in various venues, our first responders, everyone involved, healthy and free from the virus.
Governor, with regards to telecommuting, are you considering furloughing state employees right
No, we are absolutely not considering furloughing. We obviously are considering allowing people to work from home. I mean, we would encourage all employers to be flexible during this time. Yes, we are extending the spring break, and so employees may need to work from home so that they can provide childcare. We would encourage the entire community to really think about how they can help us work through this difficulty. You know, if you're going to be at home and you know your neighbor has challenges with childcare, that certainly would be something that would be helpful to allow us to work through this extension in the best way possible.
Governor, I know a lot of big events are closing or like postponing or canceling. What about some of our big tourist attractions like the Arizona Memorial that draws so many people every day?
Yeah, certainly I don't know what the status is of that, and would encourage you to keep on top of that.
Some of the school programs that exist for children run at schools. Is there a decision that's been made on whether other at-school activities, like sometimes other programs, the YMCA, for example, provides additional care during breaks? Has any decision been made on whether school facilities will be going forward with contract help for those programs?
So that is exactly why we are asking for the 4 days next week to do the planning, to work with our community partners, people who also provide additional services for our students and our families. We know that it's a complicated situation, and we don't expect, our wisest decision right now is to give our administrators and teachers time to plan without students, to make those decisions and to decide whether or not their facilities and the types of services that they normally provide can continue, need to be modified, or need to be canceled.
So, I'm sorry, I don't know this background. Are any of those programs currently expected to run during spring break now, or is that something you also put on pause?
We are asking that the programs that are right now in service during the spring break adhere to the same guidance that the Department of Health has stipulated, and we are expecting that they comply with those guidances. So sometimes if they're doing more than 100 students at a time, they can look at different ways of modifying the way they use the facilities to ensure that we're creating that social distance between students. I wouldn't have the specific details of what they are doing, but the expectation is that they are doing that.
What about kids on free or reduced lunches? How will that do that?
So during the 4 days in which we are extending the spring break, we are asking our food services to take a look at a plan that ensures us that we are reaching out to the students who rely on our breakfast and lunch program and ensure that our children are not going hungry.
Would people who work normally, from the teachers to the custodians, the people who clean, would they need to come to the schools during the break to do the cleaning the governor mentioned?
So this week is a spring break, so people have taken vacation. The teachers are on vacation right now, and so that's why we could not use this week for planning. They need their break, and so what we're asking is that the extension of the spring break is actually for the students, so that the adults, the professionals, can work on plans that help us to be proactive about what are we going to do should this virus continue to affect our operations.
It might be too early to ask, but is there a possibility the school year could be canceled? And if so, what would be the next step then for those students?
It is not something that we are looking at as the possibility. We know that education for our students is very important. Also, creating normalcy for them. We know that when we disrupt students, children's normal routines, it creates trauma, and we do not want to add to that. These are scary times for our families and for our students, and we want to make sure that we're not contributing contributing to that. So our goal is not necessarily to cancel schools. It is about how do we continue to educate and support our families and students. It may look different than what we traditionally do, but it is very important for us to continue our mission as educators.
Would you know if you folks have the tablets available to convert to online for many of the students?
So we are looking at that right now. Many of our students do have computer technology. It depends on the family and the family situation and circumstances. Second thing is that we're also looking at the capacity of our professionals to take a look at the type of instruction that they're giving and the types of courses they're providing and how much of that fits into an online blended learning environment.
Anyone else? Thank you, everybody. Appreciate it. We'll provide updates as we get them. Thank you.
Thank you.